Hello and welcome to the Integrated Rehab and Performance Podcast. My name is Dr. Nick Curtis and I'm running the show here at the Integrated Rehab and Performance Center in Nashville, Tennessee. Today we have another golf episode for you. This is golf episode 20 and we are talking about the seated trunk rotation test. This is a TPI screening test, part of their movement screen for golfers, and we are looking at and assessing the trunk's ability to rotate. So this is like your thoracic spine or that mid-back mobility, but it also includes a little bit of that lumbar spine mobility as well. And we need to be able to get separation from our trunk and our pelvis, right, which is a test we did earlier with that torso rotation test, which is not assessing for a quantity or really a quantity of degrees of motion in that thoracic spine, but it's really just looking at can you get separation from your pelvis and your thorax, right? That's that thorax rotation or torso rotation test. Is there separation? Can we move and rotate the trunk without the pelvis coming along? Can we do it smoothly? Can we do it effectively? But we're not looking at any numbers there. In this test, we are looking at numbers. So we need to be able to create a little bit of separation or at least have some capacity to do so. But we also are now looking to see, do you have enough thoracic and lumbothoracic rotation to get into a position that you should be able to get into to be an effective golfer, to create reproducible and efficient and compensation-free golf swings, right? So that we can actually begin to work on the things we need to work on without having to fight the battle of our immobility or lack of stability in our bodies, right? You don't want to have to fight your body when you're out there practicing and playing. So that's what the seated trunk rotation test is looking for. It is trying to isolate the thoracic spine and a little bit of the lumbar spine for rotation to see if you are able to get into enough rotation that will help your backswing and your downswing, right? So we're looking to see, is there any reason why you might need to compensate coming from your thorax when we are looking at your ability to rotate. So let's take a deeper dive in. We'll look a little bit at what that test is actually looking like, and then what we do when this screen comes back positive so we can take a deeper dive. So just a brief example of how we might isolate that T-spine a little bit more to take a closer look. And then also we're going to take a look at how we start the process of addressing it and what just a brief, a couple drills and exercises in a kind of sequence that will build you up that you can try and reassess in a couple of weeks and see if it's improved and how well it's improved your ability to create separation from your pelvis and your trunk and then just get more rotation out of that trunk. So let's take a look. Okay, so what is the trunk rotation test? If I were to describe it to you, we are sitting on a box or a bench, something that we have a 90-degree angle on to help take our measurements. What we want to do is kind of straddle a corner, so a 90-degree angle. We want one knee on the right side of that corner and one knee on the left side of that corner, and then we're going to place one leg over the other. What this does is it helps lock that pelvis a little bit. We can also just bring our knees together and make sure that they don't move or spread apart. But what we'll do is we'll cross one leg over the other, and then we're going to rotate towards that top side leg. So if you cross your left leg over your right leg, then we're going to rotate towards the left. And again, that helps isolate that spine and the spinal rotation from the thoracic spine and lumbar spine, and takes the pelvis and the hips out of it because we want to assess purely the trunk in this example here. So that's the test. Let's take a look at what it looks like with a video example here. Now for the seated trunk rotation test, what we have you do is sit on the corner of a 90-degree angle like this. You can use a bench or a box. From here, I want you to bring your knees together, your feet together, cross one foot over the other, and then whichever side is on top, we're going to rotate towards that side. So in this case, we're rotating towards the left. Put your hands on your shoulders like that, perfect. And then I just want you to rotate, sit up nice and tall, rotate towards your left. We're looking here to see if he breaks that plane of this box, so in that case, it would be 45 degrees through here. He does a pretty good job. Let's do the same thing towards the other side. Switch feet for me, perfect. And I'll rotate down this plane here. We see that his sternum and his shoulders cross. Don't allow yourself to cheat by looking at what the shoulder or one shoulder itself is doing, because that can cheat. We want to see through the plane of both shoulders what that angle is, or just take a look at that sternum. We see here he's at 45 degrees, and he's able to pass through it as well. All right, go ahead and give that a shot. Okay, so what does the data say? What has TPI or Titleist Performance Institute, when they decided to include this test, why did they do so? What were the PGA professionals showing? What were amateur golfers showing in this test? So they took a look at 1,254 amateur golfers and assessed their thoracic rotation, and they looked at, I think it's about 31 PGA professionals and compared the two. So we got kind of normative data for the amateur golfer and normative data for the PGA professionals. We are looking to get at least 45 degrees of that trunk rotation. So that means when we're rotating towards one side, we want that sternum or that kind of chest wall to be able to go flush or past that that reference point we gave us by sitting on the corner. So breaking the plane of that bench or that box. Now, when it came to PGA golfers, there were 0 golfers that could not hit the minimum, which again, it was broken up as 40 degrees or less. So 0% came in under 40 degrees. So that should be telling. Now, when it comes to the amateurs, there was only about 10 to 11% that could not get to that 40 degree mark, that they were getting to at least bare minimum, and there was a good chunk that was at that minimum. Now, if it's me, we are breaking out that test if you are if you're only getting to kind of flush or breaking that plane. Again, and how much do they have to work to get there? There's some subjective parts to it as well. Are they really cranking to get there? And then again, it's not a perfect test. So how much are they still getting out of that pelvis torso? Are they letting their knees come apart a little bit? Things like that. Are they kind of flexing over and trying to get some more room in that way? So if they're even coming close to not passing this test, then we are for sure going to break that out a little bit more. But again, 0 PGA professionals came in at less than 40 degrees on both sides. So if that's not telling that there is a standard here, there is a kind of non-negotiable, we need to be able to get at least the minimum. And at that, there was only few that were in that kind of 45 degrees to 50 degrees mark, and the rest were well over the minimum there of 45 to 50. So they were the kind of standard, the mean was much higher in terms of rotation for PGA than the amateur golfers. So if you want to be a good, efficient golfer, we need to at least get that minimum. This is a very important test to look at. And then when we do start to see some positive findings in it, we definitely need to break it out a little bit more and really figure out what your thoracic rotation is looking like. And then from there, we can figure out how to go about improving it in terms of addressing your separation, whether it's purely T-spine mobility, or if there's some lumbar spine mobility issues in there, or there's rib cage mobility issues as well. Rib cage is it's attached to that thoracic spine at every level, right? So it's important that we look at both, and that means that breathing is going to come into play as well. So again, why is this important? Well, there's no PGA. There's, at least the ones that were tested, none were coming back with less. So it is important. But what can we kind of guess as to why that is? If we're lacking trunk rotation or thoracic mobility, then if we're trying to achieve that backswing position and we need to be able to rotate our trunk, and the trunk isn't going to get us there all the way, what needs to compensate? A lot of times you'll see players start to stand up so they can get a little bit more rotation out of that pelvis or those hips. So we now have loss of posture, early extension, all sorts of over the top, and that kind of forward lurch starts to happen when we transition from the backswing to the downswing. Different things like that, right? We're also at risk for injury. So if you're coming in with some pain, some golfers coming in with back discomfort, again, if that thoracic spine is running out of room so fast, but we're still getting at what looks like a pretty good backswing position, how are we getting there? Besides the compensations affecting our performance and our timing, it's also going to affect our joints, right? So that low back might have to take up more rotation than we'd want. It's not designed exactly for rotation. So now our low back is experiencing torque and increased forces in that regard. Same with the pelvis and the sacrum. The hips are experiencing more force. Maybe the knees, maybe we're torquing down on the knees even more than we normally would. Again, all sorts of issues can start to arise when we are kind of limiting ourselves with that thoracic spine that we should be asking so much from, and instead are starting to ask the other joints to do it for us. Again, besides performance limitations and timing issues, we also have more injury as well as more injury potential, especially in the long term. Okay, so if we wanted to take a closer look at that T-spine, one out of there, again, there's a lot of tests that we start to do to break things out to really get a good understanding, but one very specific test that we will do here is what we call the lumbar locked rotation test. And what this does is it does a little bit better job of locking up the pelvis as well as that lumbar spine to get a really good sense of how much rotation we are actively getting from that T-spine, because now we're putting them under a little bit more stress to have to actually actively rotate. Again, it's a little bit more realistic if you ask me. We find some golfers that are borderline passing maybe that seated trunk rotation test, that we get them in this position and they don't pass that benchmark of 45 degrees here. So it's a little bit more strict, less room for cheating, still some capability of cheating in here. But again, I'd say it's the important next step to take true measurements that you want to compare to later on. So of course, we're always going to re-examine with that TPI top tier screen. But day to day, I'm going to have my golfers come in and we're going to look at this lumbar locked test. We'll do some treatments, interventions, and retest with this lumbar lock test again, because there's less room for it cheating intentionally or not, and it is more specific to that T-spine. So it is a more immediate, better test to do, and then we can see if it translates up the chain to that TPI screen that we can do later on. So I'll show you a video of what that lumbar lock position looks like so you can try it at home. Okay, this is an important test for thoracic spine rotation and extension. So from the side view, what this test is, I want you going knees together, elbows together, and then elbows to knees. From here, we're going to put one arm on the small of our back with our palm facing towards the ceiling. Now, I want you to think of yourself like you're in a barrel, and we want to rotate around our center axis like this as far as we can. But I don't want you letting yourself come out to the side like this or in towards the middle like this, okay? So it's a perfect rotation around your spine, just like this, trying to open up as far as you can. And then you test that same thing on the other side. From the front, knees together, elbows to knees, hand on the small of my back, and then I'm rotating. And you can look with your neck as well towards one side. And then you try that same thing going in the opposite direction. Again, not letting us come towards the side to open up like that. Stay in a perfect circle like you're in a barrel. Give it a shot. Use the camera to help see how far you're getting on each side. We're looking for about 45 to 50 degrees of rotation. We're breaking that halfway point as we rotate. So if we're getting to about 45 here, we want to make sure that we're breaking that 45-degree plane. Try to look at your sternum as where we're measuring. Don't use your shoulder, because we tend to be able to cheat when we do that. So go ahead, give that a shot. Okay, and then again, beyond this, there's many things we do. One would be like a spinal exam, so we can actually get hands-on and to get a good sense of the joint play, the different areas of that T-spine, lumbar spine, pelvis, and CT junction/cervical spine, see where the restrictions are. Again, in this case, the thoracic spine is going to be the most important to get a really good sense of which segments are not moving so well on top of each other in extension, flexion, rotation, lateral flexion. Get a really good sense for how that spine is moving segment to segment, and then we can use that manipulation, that chiropractic adjustment, to aid us in our process here, right? And we know exactly where to do our adjustments after that exam. Next, we look at breathing, see how they're breathing, see if that rib cage is able to expand, which areas it is not and restricted, where we're going to focus some of our mobility work onto that rib cage, and then and go from there and see how that is correlated with that T-spine mobility. Again, an important piece of information to have is what is that rib cage up to in terms of mobility. Okay, so we'd go along and collect a whole bunch of data on this golfer regarding the other issues that they had at a test they might have failed, and broken those all out into many different bits and pieces to get all the information that we need. But if we start going into how we address this, let's look first at that rib cage, right? So we can do some breathing stuff and some rib cage opening stuff, some different ways to get that low-hanging fruit out of the way and get that rib cage and T-spine moving together again. Let me show you an example of an exercise or a drill that we'll use to start that process of learning how to breathe in a certain way to really emphasize that, and then some movement we can put on top of it. Okay, for this exercise, we're going to be in the hook lying position, and we're going to start working on opening up and getting some movement through the rib cage as we work on our breathing. So once we've kind of mastered this hook lying breathing concept, where we're letting our ribs internally rotate as we exhale, so from here it's a big inhale, and then on the exhale, I want you to feel your ribs starting to close in on each other, and then I want you to maintain all that core tension and oblique tension that you used to get every last bit of air out of your lungs on that exhale. I want you to maintain about 40-50% of that tension as you breathe back in. This keeps your ribs from flying right back open. right? And so what it does is it creates some relative motion into the rib cage and the thoracic spine. Now from here, once we've mastered that, I want us to put our hands up overhead like this. And I want you to think about getting your shoulder blades out towards the side. So think about left shoulder blade towards the wall towards the left, and the right shoulder blade towards the wall on the right. Okay? And then from here, I want you to think about getting your shoulder blades towards the ceiling. So they go out towards the walls and then up towards the ceiling. And then the last one is I want them to go up towards your ears a little bit, but I don't want you just shrugging your shoulders like this. Again, it only comes from the scaps, right? The shoulder blades. So out, up, and then up towards your ears just a little bit. And then from here, I just want us to breathe. Trying all along to maintain this position and even emphasize it more. So get the scaps even higher and wider, and then up towards your nose even more. So breath in through here, all the way out. And then breath back in. Again, our core tension that we created maintains our ribs relatively down. Instead of just flaring right back open, we keep them down. And again, on the exhale, we're starting to reach even further and further and further with the shoulder blades. You see my elbows are bent. It's because the reach isn't with our arms. Again, it's with our scaps and our shoulder blades coming around our thorax. And again, I want us to practice this position. Then from here, one last progression is I want us to start rotating. Thinking about getting our shoulder blades up and around, high elbow, as we maintain that rib position, that rib tension, and we start to breathe in slowly through that as well, okay? So try those progressions, again, master this one here, then move on to this position here where we're just breathing and getting our shoulder blades out and wide and high, and then the last one where we start to incorporate some movement as well. Okay, give that a shot.
Now, addressing the spine itself, and that T-spine especially, there is a few key concepts. Again, I'm going to show you 3 exercises here and drills that we use to help along the way, but there's always much more going on behind the scenes than maybe just these 3 exercises, right? But these all have a specific reason why we're using them. We're first going to look at just trying to get that T-spine to open up beyond our manual techniques and maybe some other breathing techniques and very specific extremity and breathing stuff. In this case, we're going to move on a little bit past that and go right into some passive mobility work where we're using an external load to help us a little bit, and then a little bit of breathing and constraints in the environment that get us in a position to help influence that T-spine to rotate. So after that, we are doing a drill to help kind of use more active means of rotating that spine. Again, we still have some constraints, but we're still putting some pieces together. In both cases, our pelvis was in a it was in a kind of stagnant position where we are not allowing it to move along with us too much based off the positioning of our hips and knees, or just on our cueing of not letting that pelvis move. And this is, again, anytime we're building that thoracic mobility or trunk mobility, we want to make sure that we can access it without having to drag the pelvis along, so that we're separating those two so that they can move together if we want them to, but they can also move separately. That all our improvements in thoracic and trunk mobility is going to come along with control over it, to control it on top of a stable pelvis that we can decide what to do with. So those are the first 2 exercises, and then the same theme is here in the third exercise, which is, again, more active use of T-spine rotation. And again, we're in more of a golf and a standing position, so now we're really upright, and we are putting it all together with other golf-specific positioning and cueing to really, again, start to strengthen ourselves in this position, put some more challenge to that rotation and mobility, and again, it's more of a integrated approach at that very last exercise there. But again, we are still working on getting separation and being able to control separation from trunk to pelvis. So let's take a look at these 3 exercises. You can try them at home. We'll walk you through how to do them here.
Okay, for our kettlebell thoracic spine opener, what we're going to do is we're going to pick a side. We're going to lay with our bottom leg long and extended. Our top leg is going to come up to 90 degrees of hip flexion, and we're going to place that on an object that's going to give us feedback. So we want to make sure that this knee never leaves this foam block. Again, my hip stays at 90 degrees or higher. I take a kettlebell. I want to go top side arm towards the ceiling. This back side arm and shoulder can relax out to the side. And I'm going to let this weight help me as I rotate down towards the mat. Okay? From here, we're not letting this left knee leave this block. Otherwise, we could just cheat, and we're not getting much thoracic spine rotation from this. What I want you to do is start in this position. We're going to move it into as much rotation as we can before this knee comes up. We're going to hang out here for a breath. So a breath in through the nose, out through the mouth. And then we're going to go back to the start. And I want you to repeat that 4 reps. We can increase the load on the kettlebell, whatever's comfortable for you, as we continue to move into more and more thoracic rotation over time. We then just switch and do the same thing on the other side. What this looks like from the side, bottom leg stays straight. This hip's getting towards 90 degrees or higher. I'm going to grab my kettlebell. We're hanging out here first. I don't let this knee come off the block as I rotate down and we breathe in this position. Always reaching towards the ceiling. And then back up. And we're doing that for reps. Right, go ahead, give that a shot.
Okay, for this thoracic rotation drill, we're actually getting a lot to happen here. So in this position, we have our left foot forward and our right foot back. Our hips are at 90 degrees in either direction, and our knees are at 90 degrees. So if you can mimic this 90-90 kind of shin box position is what it's called, then that's a great starting point. What we're getting here is external rotation of that left hip, internal rotation of that right hip. Now, this might be a little bit difficult for some of you to get into this position. If so, we can just work on, first of all, getting into this position. The more we can improve that, then the better our golf swing, right? Because we need to get into the backswing, left side external rotation, right side internal rotation. That's exactly the position we're in here, right? So we're getting that reciprocal motion where one side is doing one thing and the other side is doing the opposite. Now, where we can upgrade this and turn it into a thoracic rotation drill is we hold this ball. If we don't have a medicine ball, then just think about kind of giving yourself a big hug and creating tension in that way. And we're going to rotate towards that backside leg. So in this case, we are rotating towards that backside leg, and we're just kind of hanging out in this position. Now, what we need to do next is just own this position. So you should imagine yourself, we're going to breathe in through the nose, nice and slow. Breathe out through the mouth. Let the air kind of fall out of your mouth. Again, we're going to take a long time on these inhales and exhales. Own this position here where we're rotated towards our right side, and feel the tension start to build in your abs as you're pushing out every last bit of breath there, right? That's really important. Feel your abs start to turn on a little bit. Maintain that tension, 2 or 3 out of 10, and then breathe back in through the nose, maintaining that tension. What that does is that forces our ribs to internally rotate and kind of close down on each other. And then as we inhale, but maintain all that tension that we've built with the abs that are actually pulling those ribs in those positions, is that we keep those ribs down, and then we inhale, and we're teaching the diaphragm, we're teaching that thoracic spine, we're teaching those hips how to exist in this position as we breathe in and out, right? So that helps with the brain. It also helps with the tissue that are controlling these joints to start to get used to and actually adapt to these positions here, okay? So we start chest facing forward, we rotate towards that backside leg, and then from there, we breathe, breath in through the nose, breath out through the mouth, maintain that tension, another breath in through the nose, and then we can rotate back facing forward, and then we can rep that out. Just repeat that 4 to 5 times, kind of owning that rotation. Again, trying to get a little bit more rotation each time, but also trying to make sure we're standing up as tall as we can and standing tall as we do it, right? So a great drill to get everything working together. We are in a perfect backswing position here, though it doesn't look like it. We have our left hip in external rotation, our right hip is absorbing that external rotation, creating internal rotation on the right side, and then we are rotating our thoracic spine to the right. Again, try this in both directions. It's important to try to maintain some of that symmetry, especially in a sport like golf where we tend to be so asymmetric. That leads to that pain, that discomfort, that overuse, right? So as a pain prevention, kind of prehab, make sure to do it on both sides, and then the same thing on the rehab side, we do it on both sides, but just make sure that we are getting it, and especially paying attention as we rotate towards our right with our left foot forward and our right foot back.
Okay, for our medicine ball backswing drill, it's going to be a great drill for working on our upper body association and our thoracic spine mobility. And again, we're doing this in our golf posture. So what we need is medicine ball. Keep it very light. What you're going to do is back up against a wall, and then you want to find your kind of 5-iron posture, like you're holding a 5-iron, kind of what your body stance looks like as we do that. And you just want to be far enough away from the wall that as you get to that stance, that your butt is just brushing up against the wall. And that's just going to be there for some feedback. It's going to let us know if we're standing up and kind of coming out of that golf posture. So what this drill is we're going to be in our golf posture, and we're just working on that take back. So we're keeping our head straight, and we're going to be looking down over our shoulder as we do that. If you don't have a medicine ball, you can use a weight. Again, keep it light, and just hold it like this. Find that posture, and then just working on our take backs. You'll notice if anything changes, if you're compensating, if your butt starts coming off the wall. Okay, so just trying to maintain that angle and working, and you'll feel your rotators in your mid back especially working pretty hard to get you back there. So it's a good mobility and kind of motor patterning drill where we're really getting these muscles to turn on to do that motion, but also we're getting some mobility into that as we do it too.
Okay, so those are 3 examples plus the rib cage example there being the 4th of how we can start addressing specifically trunk rotation and areas within the trunk to improve our golf game and reduce our risk for injury. Again, this test is just a screen, so we will almost always need to look closer. If anything is starting to come up a little strange on that test where we're not quite getting the mark or it looks like you're working too hard to get there, then we're going to do that lumbar lock position and get a better sense for what's going on. And then we combine that with joint by joint testing to see what is happening at every joint, some breathing testing, and then some big global movement testing to see how well you integrate this test. Again, we had a big global movement in that seated trunk rotation, but I want to see what it looks like in a more specific way. So we always do some very realistic activity-specific testing where we can start assessing that T-spine rotation as well with golfers. So again, lots of testing beyond just this screen and that lumbar lock position, but for brevity, we just showed those 2 and gave you some examples and ways that you can test it at home and start addressing some findings if you found anything interesting there. Otherwise, there's much more on the YouTube channel in terms of specific exercises. Check out the other podcast episodes and blog articles because they all include different exercises and different reasons for using different and the same exercises, so you can use the same exercise with different cueing or just with different goals to get different results. So again, check out all that on the YouTube, Spotify, and the website to kind of start putting everything together a little bit. We got a good deal of information out there now, so it's a good source for everyone there. Otherwise, that should be it on the seated trunk rotation test. Listen to it, watch those exercises again, give them a try, see how they feel, see how they start changing some things. If you need anything more, feel free to contact me at the email, contact@integratedrpc.com. Give me a call, head on the website, and reach out via the website, and I'll be happy to chat and see what you need, whether it's performance or rehab care, whatever it might be. So thanks for listening. We'll see you next week.